Welcome, and thank you for tuning in to the Texas System of Care podcast. In this installment, Lupe Shanklin, Executive Assistant and Match Coordinator for MHMR Tarrant County, will discuss match funding for System of Care grants, what it is, and how to document it. The slides for this presentation, along with a video and downloadable MP3, are available at txsystemofcare.org.
This is Lupe Shanklin. I'm with MHMR of Tarrant County, and I'm here to talk to you about match funding. Definition of match. Some of you may not know what match is. I know I didn't when I first started. Basically, the match funds represent non-federal donations of expenses related to collaborative activities of your providers and your community stakeholders addressing system of care improvements. The federal law defines match as non-federal public or private funds not used as match for any other federal program. That's very important. Also, funds spent on the system of care, and it's either cash or in-kind that is fairly evaluated. Bottom line, if you could have spent grant funds on an item, you can count it as match. Match funding is required by federal law to match federal dollars with non-federal dollars. Also, you'll see non-federal dollars referred to as local dollars, so dollars that are in your community already. The match requirement is calculated based on your actual expenses, and every year the match levels decline. I've given you an example of some of the grants that I've worked on how that federal ratio to local is declining. In the grant that several grants that I've worked on in that last year is the hardest because you've got one federal dollar and you have to find two local dollars in your community. So it gets a little tough towards the end. I want to take note that the collected and document match funds in excess of the amount required, you can carry that forward with the permission from SAMHSA. And you can only carry that particular match that you've documented and collected only once. So keep that in mind. This slide I put in, what is system of care? I know we all know what that is, but I know when I first started, I needed this particular statement next to me until I really sunk in. So what I used to do, I actually printed it out and I taped it on top of my desk just as a reference. So that's all this is just a reference for you. And if you want more information about it, I included a link at the bottom to the TA partnership. You'd be happy to click on that and you can get some more information. Next few slides are examples of the type of match we're talking about. This first one is cash match. Pretty self-explanatory. Any funds spent on the system of care, private or any of your partner agencies, funds redirected from another service to community services for the system of care. Private grants, donations from foundations, example. But they all need to be necessary, reasonable for proper and efficient accomplishment of your program objectives. Another really important thing I used to keep by my desk is the goals and objectives of the grant. If you have that, it would be very easy, and it helps you to identify whether that match is allowable for your grant. The next slide is going to be examples of in-kind match. This would be staff time and mileage time of your agencies or your community stakeholders that attend meetings for your grant. All that time, you can count it as match. Time contributed by the families and youth at wraparound meetings. Just keeping in mind, do not document any client names on your match documentation. If you have a document that you need to use as backup, just mark the names out. Make sure they're marked out clearly. Any donated professional time, physician, a dentist, a counselor, any of that time, you can count it as match. Free advertising. Maybe you're doing some advertising, you've got a media consultant, a web designer that's helping you get the word out about your grant. If you don't have to pay them, you can charge that as match. Any space donated for, let's say, trainings that you might have or meetings that you might have can also be counted as that. Cost of various forms of transportation that are donated to the families. Trainings. I did a lot of YMCA membership fees, a lot of recreational activities where they were actually donated by the provider. In this case, it was YMCA. And any cost of various office supplies that you that someone donates for you, like copies, or if they're putting binders together for your trainings, all of that can be counted for your match. And I did want to explain the way I captured the match is I actually created a form where a lot of our community stakeholders could complete, and I would actually meet with a lot of these community partners to train them on how to use the forms. Many times that the agencies would prefer just to send me the documentation, and then I would decide whether this qualified as match for this particular grant. And that option worked better for us and for me. It just took a lot of time away from the community partner that they didn't have to make that decision whether it applied or not. So I took that off their plate, and I did that for them. Many of the agencies, we have a good community network in this area, and they're all buy into the system of care, and we all work together. So I was very fortunate that I never had any trouble obtaining match. So that's why it's very important that we do network, we do get our community partners and stakeholders involved, and buy into what you are doing for your grant in this system of care. And what you'll find is a lot of them are already doing it. So, so then it's your job to make sure you pull that information from them, get that documentation, and you can report it for them. And when I report it by agency, by month. You have to report match every single month. So keep that in mind. I do have forms for that. I do not have them on this PowerPoint because it's a little bit more involved. But if you want me to send those to you, I'd be happy to. I've included my email address on the first slide, so please don't hesitate to ask me. This slide talks about estimating value of in-kind match. First of all, it must be fairly evaluated at the time it's donated. Space and equipment where a third party has title must be valued at fair rental rate. Volunteer services by professionals, technical personnel, family members, consultants, others must be a necessary and part an approved program. Basically, it has to be part of your goals and objectives, and it's allowable. It's an allowable cost. If the program had to pay for it, you can count it. Calculating volunteer rate when site has no employee performing similar work Rates must be consistent with those paid for similar work in the labor market. So, for example, I have a nurse that used to attend several of our community. Maybe that's not a good area. The Texas Workforce Commission. I mean, I use it every single day. That is going to be your best reference unless you actually have their hourly rate. And I don't include fringe benefits or anything. This is just a flat hourly rate that I use. Let's see. This slide is very important. This identifies what you cannot use as match. Federal funds from any source. It doesn't matter. If it's federal money, you cannot use it as match. Non-federal funds that are used to match another federal program or project. Funds in another part of the state or locality. Funds expended for services to children in the community who are not served by the system of care. And funds that are spent for a purpose not permitted by your grant. So that's where that goals and objectives, knowing your goals and objectives is very important. Accountability means your documentation of the contribution of the donation, your match. This is one of the things that the auditors will look at. They will inform you ahead of time if they are going to audit you. This is where your documentation comes in, very important. I have been audited a couple of times in 2 different grants that I've worked under. And they'll either do one or 2 things. The auditor will either ask you for specific match documentation, or they will go through your records and just randomly pull certain match documents that you've reported. So either way, they've both been very painless. They ask a lot of questions. They will ask you why you think this match was allowable for this grant. So again, very important to know your goals and objectives of the grant. This next form, I apologize, and this is an example of one of the forms that I use to document match. It's very simple. You have to document the date that the donation was given, who gave that to you, and a lot of times in my case it's an agency. In this one it was Cook Children's, so I had to put Cook Children's, their full address and phone number. The auditor may call the donor, so you want to make sure that your contact information is correct. Then you just give a description of what that match donation is. In this example, they attended a trauma committee meeting that was held at Lena Pope Home for an hour and a half. These 2 people were non-federal employees, so I was able to count their time. I found out what their job titles are. Then I went to the Texas Workforce Commission, find out what the mean wage is, and that's how I got the hourly rate. I times that by the number of hours of this meeting and then totaled it out. The rest of the documentation is just basically the same thing. I always put it on the form, what's counted, what's not counted, as just a reminder of those who fill out this form, just in case they forget. And of course they can always call me, and but I find that just documenting just a few notes at the bottom, just a reminder of what counts, what doesn't count, also helps quite a bit. I do have several other forms that I use to document match. They're a little busy, so I really couldn't get them on a slide, but I'd be happy to send you examples. Or if you want to use my forms, I'd be happy to send you some blank templates. That's no problem. And again, as a reminder, do not put client information on any of this documentation. If you have backup that has a client's name, please mark through it. This next slide is all the resources that will help you. The very first one is the Code of Federal Regulations. I'm sure you might have seen some of the CFR. If you look at your Notice of Award, your NOA, that documents the terms and conditions of your grant funding. So it's very important that you know and understand those CFRs. The rest of them are circulars that will also help you in the Office of Management and Budget, OMB. I've given a short, quite a few there that I use that are very, very helpful. A lot of these as well will give you more information about match as well. Cost principles for your grant. Let's see. Last one is another slide of resources. SAMHSA, of course, you can always go there. They always have a full array of resources. Here's the Texas Workforce Commission website that you can use that I referenced earlier. And the last reference there is retention and access requirements for your records. Basically, when your grant ends, you have to keep all your match documentation 3 years from the date when all payments or any pending matters are settled. After that, you can you will need to shred them, but I strongly suggest that you go to this website and get some more details about that. If anyone has any questions, please feel free to email me. My email address was on the first slide. If you feel like you need more information, and maybe I can do a little mini training with you, I'd be happy to set up a time and a date, and we can schedule either face-to-face or a phone call. I'd be happy to do that. Thank you again, and if you need any more information, please don't hesitate to contact me. Thank you.
We hope you've enjoyed this presentation on match funding. For this and other podcasts, please visit txsystemofcare.org.